Hi, I'm Mitchell Smith, the Chief Medical Officer of the Follicular Lymphoma Foundation. I wanted to follow up on our recent webinar, uh, following up on exciting events at the International Congress for Malignant Lymphoma in Lugano. We did not have time to address all of the questions, and I wanted to take a few moments uh, to do that at this point. Remember, I'm not able to give individual advice. You need to talk to your healthcare team for that. And for some of the questions, we've covered some of these in the earlier webinars, which you're welcome to look at on our website. And especially our upcoming webinar coming on August 13th on bispecific antibodies in follicular lymphoma, which we're really looking forward to. So some of the questions had to do with treatment and cure. I think we talked about in the webinar the difference between cure and a functional cure. Functional cure being that you live as long as you would without the follicular lymphoma. But unfortunately, we don't have a test to tell us whether you're in that group, so it doesn't get rid of the anxiety and concerns that Paul talked about in the webinar. So it'd be great if we could develop such a test, but work is going on in that direction. The bispecific antibody data does look very exciting, as was mentioned, alone or in combination with other agents. We think that we may be curing, or at least functionally curing, some patients with that, but again, we can't tell yet. These may well replace chemotherapy, and in fact, studies in many areas are ongoing that you might be eligible for, either as your first treatment and certainly later treatments that would involve bispecific antibodies. So if you are needing treatment, you might seek out one of these and see if it sounds good for you. One of the people in the chat mentioned that their family member was going to have bendamustine and rituximab, a sort of classic chemotherapy and monoclonal antibody combination. And that certainly remains a good treatment since we don't know yet whether the bispecific antibodies and CAR T cells will be better in the long term. Other people asked about variables associated with relapse. Can we predict who's going to do well and not after these immunotherapies? This is another area of intense study, some of which we're funding through our organization, but there are no answers yet. A number of other questions dealt with holistic medicine, effects of stress on the immune response, and the possibility of affecting the follicular lymphoma, and also the gut bacteria called the microbiome, and that has clear effects on immunotherapy such as CAR T and bispecific antibodies. These are all interesting areas under active study with no firm answers yet, so I would say stay tuned on these. And finally, there was a question about artificial intelligence, and certainly the power of AI is being brought to bear on all of these questions that I went through, and basically is revamping and accelerating research overall, and certainly in follicular lymphoma. So we look forward to things happening more quickly if we can apply AI. So hopefully this addressed some of your questions. Others, hopefully, you can find in our webinars that are up on our website, and looking forward to the bispecific antibody-focused webinar coming up in August and our continuing series through the rest of the year. Thank you for your attention.